We're here at fyh.news, and we have Dr. Garcia-Saiso. Thank you so much for joining us. You're joining us from PAHO and the World Health Organization. I was saying earlier, it's been a very busy 5 years for you, I'm sure. But we're so excited to have you as part of this conversation because we're going to talk all about digital, we're going to talk about AI, and just really thrilled to hear some of the insights that I know you're going to bring to this conversation. So before we even start, why should people know about PAHO and also the World Health Organization? What is the work that you primarily lead?
Well, thank you for having me and for this opportunity to get to an audience that I'm sure will find interesting to know a bit more about us. So the Pan American Health Organization, PAHO, as you just called it, is the regional specialized agency for the Americas for health. And is the regional office of the World Health Organization as the specialized agency of the United Nations. And as you know, yes, you said it very well, it's been a very busy few years, of course, from the detection and the setting of the emergency due to COVID-19 and what it meant for every single country, every single person, community in the world. And of course, this is no exception for the region of the Americas, but we are now at a different stage. We're coming out of the pandemic. We are now at a moment where countries and societies as a whole need to address some of the challenges that were present during the COVID-19 and some of the things that were highlighted by the pandemic that now we see as an opportunity to make our health systems globally and of course regionally more resilient, able to respond not just to future emergencies that we will for sure have, but also to changing health needs, to those needs from the communities, the persons that change over time that we need to be able to address from identification and then providing the right solution for this. So it comes from, for example, dealing with an agenda that has been with us for now decades, and particularly on some diseases and particularly some neglected diseases that have been there, and we need to focus and particularly target vulnerable populations that had been left behind somehow in this agenda. But we also have to look at the emerging agenda. For example, learn and to implement better action to address non-communicable diseases and how this is affecting large proportions of our population in the region and globally, and how to leverage science, available technology, and make this a reality for all, so that we may all improve health in our populations and globally.
Yeah, and that's so important because I think historically, most people would not think emerging technology with health, because the health sector has historically been very traditional, from what I remember, very paper focused. And now digital, you talk about emerging agendas and emerging technologies. Let's spend some time there. As our society and world is moving so quickly with the introduction of artificial intelligence, the mobile phones, how does this impact the agenda that your team is working on?
So we deal with a comprehensive agenda that goes all the way from data and how this data is generated, it's captured at the local level. So working on information systems, and you mentioned the importance of the digital agenda on all of this. So how do we transform our systems so that they're better able to capture this data, all the way to digital health and all the tools that are now available to make not just care and access to care for everyone, but also information and knowledge and democratize the access of this so that we are all able to make better decisions. All the way to once we have data, what do we do with it? So how do we make better analysis? How do we build models and generate even in projections so that we're able to plan ahead and identify those areas that we're not covering. And of course, this is very much linked also to the agenda on science and knowledge. So how do we really harness the power of science and the knowledge that we have collectively now to improve health of all? And this includes looking at particular populations and particularly those underserved and vulnerable populations that can also and should also benefit from all this that is available. So that's a comprehensive agenda that we have, and we work as an organization across many different topics and priorities from our member states, from countries. And we see very optimistically that now countries have prioritized the digital agenda. So we've now in a region of the Americas that has embraced the digital transformation of the health sector as a priority as we move forward to build more resilient health systems. And this implies talking about telehealth and how do we bring and provide services to those that previously didn't have. Using artificial intelligence, which was a topic discussed today at the forum, on how can we use these technologies so that we better identify populations' health needs, and how do we also generate other tools so that people have access to diagnostics, to treatments, and so on, based on these emerging technologies from a safe and high quality perspective as well, making sure that this is well regulated and within this scope of the development of the health system.
How are you seeing the reaction to telehealth across the regions you support? Do you think that people are accepting of it, this bring it on, this increases more access, or do you find there's a little bit of hesitation? I'm not sure if this is actually holistic enough for me.
Well, telehealth has been around for more than 3 decades, so it's not something that is really emerging now. But for sure, COVID-19 and the disruption that was caused in health services overall made this part of the highlight, made this part of looking at those alternatives that were there, ready and ready to be implemented, but have been overlooked somehow. So now most countries are advancing in a very accelerated pace to introduce this as part of regular service provision, whether it's to increase, for example, access to specialized cares from primary healthcare units or first level units in underserved areas, or whether it's to generate remote access for patients that can't have mobility or can't have access to physical units in a particular setting. So all of this is moving very fast. Countries have moved now to introduce technology, to introduce platforms to make this possible, but also having the overall needed regulatory framework adjusted so that this is part of the reality and not just a thought on technology implementation, but more on how do we make it part of the health ecosystem.
I like that.
So this has been happening. I think it's part of every single country, and of course a top priority for us at PAHO as well.
No, it's important. And I like that you said the country's agenda has this as a main focus. This is something that they are prioritizing. So it makes it easier to be able to have implementation that everyone is all on board for. So major kudos to you and your team for leading that. And so I want to spend some time on AI, because AI, that's all. I wake up every day and there's a new AI article. And what does AI, for someone who doesn't understand and they think it's robots, how does AI actually work in the healthcare system? And if you were to explain it to like a 5-year-old, how would you explain AI in the healthcare system and what it has a possibility of doing? And maybe if that's too broad, one example of how AI can work.
Definitely. I mean, things have changed really fast. Now I believe, for example, that a 5-year-old is probably able to explain this much better than me. But this is part of how technology advances and how this is introduced. And now new generations are talking about a future that, for us, it's like science fiction. For them, it's what they've known all their life. So this is how change happens. So artificial intelligence, again, as we were mentioning in the case of telehealth, it's not something new. It didn't just appear over the last few months when it's obviously become at the center of the public attention. But this development over a few decades has led now to the potential or the capacity to make it public, to make it open and accessible for many. And this has a great potential benefit in healthcare. So we see how AI, so algorithms, have been now introduced to improve diagnostics and how we can generate screening before, for example, an X-ray image is seen by a human, by a trained professional. And how this improves not only access for those that might not have an available health professional for that particular image test, but also improving the results of those screening tests. We see now also the use of algorithms, programming, coding, to help us identify trends in large data sets. Data that we've had before, but we didn't have the capacity to analyze. So we're using this to detect, for example, inequalities in access, using large data sets on access to healthcare data, or learning from many different studies that have been conducted before to train algorithms on detections, or on defining treatment pathways for patients, having also a now possibility to generate personalized care, so that we don't just generate general guidelines, but we might also analyze particular individuals' characteristics and use this as part of the implementation of the algorithms to define particular treatment pathways. So this has also great consideration. We've seen now that it's been mentioned everywhere on the risks of AI, and this has to be clearly and stated and very transparent as well. So there are risks of generating, for example, biases. So this algorithm works depending on the data that you use to train them. So if you don't have a very wide and comprehensive use of data representing all populations, then there is a risk of bias. And this goes for whether you're talking about gender, or ethnic origin, or many other aspects, even genetics. So these are the challenges that we're facing now in terms of how do we make sure that the benefits that AI pose are available for everyone, and that when we use AI, we make sure that this is the case, and particularly in healthcare, so that we use it to bridge gaps and not to generate others.
I think you did a great job explaining it. And I think you also, for someone who is more of a casual observer about AI and the hysteria around it, I think it's important to showcase why those examples are important. Like, we have all of this data, but humans are humans. Maybe we have opportunities where we don't see that this data set is incomplete and all of that. AI has a chance to really make it more allowable for us to see patterns, trends, all of that, which will help us move faster as a society, help us get patients the care that they need in a more efficient way, and embolden organizations to have more resources, right, to support the populations that they're serving. So thank you so much for breaking it down. I walk out a little bit less nervous actually about AI, because I think you did a great job explaining how it could be beneficial for us as a whole. And congratulations on all of the great work you're doing at PAHO and the World Health Organization. I hope you have a vacation lined up later on this year, because it's probably very well deserved. Thank you so much.
Well, thank you for having me.
Of course.